Across Boise, Meridian, Eagle, Nampa, and the rest of the Treasure Valley, families are asking the same question. Should we stick with regular health insurance, or switch to a healthcare sharing plan? With premiums rising for some Idaho households, especially those who don't qualify for your Health Idaho subsidies, healthcare sharing plans have become a serious alternative. To help people make a clear decision, this guide lays out how each option works, who it fits best, and what Boise advisor Chris Antrim looks at when comparing them side by side. Coverage differences that matter in Boise. Pre-existing conditions insurance must cover pre-existing conditions under ACA rules. Health sharing often has waiting periods before pre-existing needs are shareable. If a Boise resident has diabetes, heart disease, or recent cancer treatment, Chris usually leans heavily toward traditional insurance unless there's a very specific and well-understood sharing option. Prescriptions insurance usually has a structured formulary and copays. Health sharing may only share prescriptions related to an eligible incident, or may have limited prescription support. Heavy RX users in Boise typically do better on insurance, not sharing. Maternity for growing families in the Treasure Valley, this is huge. Insurance. Maternity is covered as an essential benefit. Health sharing. Typically shared only if membership began before conception, and even then may have caps. Who should stay with traditional insurance? Insurance usually remains the better fit when there are serious or multiple chronic conditions, the person takes expensive brand name medications, the family is planning a pregnancy soon, there's a strong preference for regulation and legal guarantees, the member wants robust mental health and preventive benefits. Talk to a Boise advisor before you decide. The choice between healthcare sharing and traditional insurance is a serious financial decision. Boise residents can ask Chris Antrim to compare ACA plans versus health sharing options, walk through risk scenarios, surgery, hospital stay, pregnancy, show real cost comparisons over 12 months, help you choose a path that fits your budget and risk tolerance.